Good afternoon, everyone. Welcome to today's webinar on an online consultation on incentivizing healthy foods and de-incentivizing ultra-processed food and sugar sweetened beverages to prevent NCDs. It is my honor to welcome Dr. Rakesh Gupta, who's the president at Sipher, Dr. Poonam Khanna, one is Invitational Professor of Nutrition at Department of Community Medicine at PGIMER, Chandigarh. It's also my honor to welcome Dr. Tina Rawal, who's a Senior Research Scientist at Public Health Foundation of India. Uh, followed, also would like to welcome Dr. Sandeep Bhalla. He'll be joining us shortly. We'll be starting our presentations and our session by 12:05. I would request all the participants who to ask their fellow colleagues to join in. We still have 4 more minutes, so you can tell them to join in as well.
Dr. Paridhi, you can start with yourself. Introduce yourself.
Okay. So I'm Dr. Paridhi Mody. I'm a doctor and a public health fellow, and I work at Eco India as a manager, and I'll be your host for today's webinar. So do we start the session or do we start at 12:05? We can meet
At
for a
12,
few people
12:05.
yeah.
12:05. So I'm Dr.
Yeah.
Rakesh Gupta from Chandigarh. I'm from Sipher. Pratibha, you may introduce yourself. Pratibha?
Yeah, hi, good morning. My name is Pratibha Mahajan and I'm a dietitian. I'm running my diet clinic by the name of Pratibha's Diet Clinic in Sector 2, Panchkula for last 11 years.
Okay, thank you.
Thank you.
Aniket.
All of them can just open your cameras and unmute yourself, and you can introduce yourself.
Yes, Aniket.
Yes, I'm Maniket and I'm working with the National TB Eliminations Program with the organization of Fall Harry, which is Fall Foundation of Livelihood, Health, Education and Rehabilitation Unit. Currently, we are dealing with TB patient and their caregivers. Today, I'm joined here that only reasons because nutrition part is most important in the TB cases. So my clip will help for us. We implementing those details, whatever I learned today.
Okay.
Thank you for this wonderful opportunity.
Vibha, please. If Vibha is not there, Mamta, Sonam, anyone? Rajendra, Manju, Angela, Deepika. Any one of you can introduce yourself, please. Kanta, Anjali, Dr. Tina. Tina, you have been already introduced.
Yeah, very good morning, sir, and thank you so much. So this is Tina Rawal. I work with the Public Health Foundation of India as a senior research scientist, and happy to share some of these studies, evidences, what we have collated, I think, since in few years, and maybe in the next upcoming session. Thank you.
Thank you. So anyone else can introduce?
Hello, good morning.
Yeah.
I'm Dr. Kanta from Marwadi University and the Dean Faculty of Sciences.
Okay, thank you. Thank you. Anyone who is present? Dr. Deepika, Angela, Manju, Rajendra, anyone can introduce? Dr. Poonam Khanna. So good afternoon. So you can introduce yourself, please. Dr. Poonam Khanna.
Good afternoon, sir.
Yeah.
Yeah, this side Dr. Poonam. I'm additional professor of nutrition in the Department of Community Medicine and School of Public Health at Postgraduate Institute of Medical Education and Research. So I'm really excited to be a part of this, great initiative that has been organized by Dr. Rakesh. Thank you so much.
Thanks for joining. Yeah. Arushi, you can introduce yourself, please. Arushi, Jyoti, Jassi. Susan, you can also introduce yourself, please.
Hello, sir. How have you been?
Yeah,
It's been a while.
yeah.
Good morning, everyone. My name is Susan. I am the director for Faith Foundation, an NGO in Gujarat, and I basically we working in tobacco control, de-addiction, various issues, and this seems to be an interesting issue I wanted to explore and understand because it's part of NCDs as well. So
Yeah.
anything related to lifestyle diseases, right? And hence I joined and I had some time and I said it would also give me some opportunity to say hello to Dr. Rakesh. That's why.
Thank you.
So
Thank you.
thank you so much for the invite and I look forward to the session. Thank you so much.
Thanks. So Dr. Rakesh Gupta is with us from Jaipur. Yes, Dr. Rakesh Gupta. Please introduce yourself. Okay, maybe he is not able to listen to us. Paridhi, you can just straight away go to the slides and the rest can introduce themselves in the chat box, please. Thank you.
Yeah, so before we start, just a small reminder to everyone. If you have any questions or any queries, you can put it in the chat box. We'll be having a question answer section at the end of the webinar. So kindly please put your questions or you can unmute yourself once we go to that section. Meanwhile, it is my pleasure and honor to invite Dr. Rakesh Gupta, who is the President and Director of Public Health at Strategic Institute for Public Health Education and Research. He'll be giving an overview of the issue. So over to you.
So after this, Dr. Paridhi, we can have a snapshot also, right?
Yes, sir.
So I'll be giving an overview of the issue. So India is experiencing an expanding burden of NCDs or non-communicable diseases. It's partly due to the increased consumption of the sugar sweetened beverages and what is that, UPFs, ultra processed foods. So, an advocacy and policy acceleration initiative focusing on India by the organizations like Sipher and Department of Community Medicine, PGIMER, Chandigarh, who is being represented by Dr. Poonam Khanna, will push for a national evidence-based tiered GST on selected UPFs and SSBs with legally binding earmarking of the revenue for school drinking water, school meals, healthy school food procurement, and subsidized fruit vegetable vouchers for low income students and pregnant women. And I will tell you that Hriday of the Healthy India Alliance is already working on the issue. Thank you. So next, please. So these are some kinds of UPFs and SSBs, so which can lead to NCDs. Next, please. NCDs such as diabetes, cardiovascular disease, and obesity, they are substantial and growing public health concern in India, with diabetes affecting tens of millions of people and costing health systems significantly. Decreasing consumption of sugar sweetened beverages and ultra processed foods is a promising high impact preventive leverage. WHO and other prominent public health agencies, they recommend fiscal measures on UPFs and SSBs as they are effective in reducing the consumption and funding of the health projects. Fiscal measures for price-sensitive products linked to NCDs are recognized internationally as best practices. Next, please. As you're aware that in India, the GST on sugar-sweetened beverages is a flat 40% as of September 22, 2025. Prior to this, it was 28 plus 20% tax, so it remains the same. While the tax on the ultra-processed foods varies depending on the product, with many items such as which attract GST as 5%. 40% rate on SSBs classifies them as sin goods like tobacco and alcohol, in line with the public health goals to reduce the consumption of the sugary drinks. So GST on sugar sweetened beverages and GST on ultra processed foods, I've already told about it. The GST treatment for UPFs is less consistent than for SSBs. While the government has increased taxes on the sugary beverages, it has reduced GST on many packaged and processed foods, as I told you, to as low as 5%, which critics argue incentivizes the consumption of some UPS. Next, please. So here's the breakdown of the new rates effective September 22 for several food categories. Most processed and packaged foods moved from 12 or 18% to a uniform 5% GST. This includes biscuits, cakes, chocolates, ice creams, pastas, noodles, ready-to-cook foods, and namkeens. Then refined sugar products like sugar cubes and some confectionery items, they have been reduced from 12 to 5%. Sauces and condiments, they have been reduced to 5% GST. Protein supplements and food additives, these items generally fall under the 18% GST. Next, please. So the key takeaways are that there is an inconsistent approach. The reforms show an inconsistent fiscal approach to the public health, while SSBs are heavily taxed as sin goods to curb the consumption. Many other UPS linked to lifestyle diseases receive a tax cut, making them more affordable. So as the taxes increase, the items that becomes unaffordable. Economic Survey 2025 recommends in January 2025, the Economic Survey recommended to address rising health concerns like obesity and diabetes. Impact on consumers, the tax changes results in lower prices for many common grocery items and packaged snacks. However, fizzy drinks and energy beverages have become significantly more expensive. So I may tell you that we have already met some senior IRS officers and some members of the GST Council, so who have promised to keep this in mind when they meet next. So thanks a lot.
Thank you, sir, for giving the overview of this issue. I would now like to call upon Dr. Khanna, who is an additional professor of nutrition at the Department of Community Medicine and School of Public Health at PGIMER, Chandigarh. She's a distinguished academician, researcher, and public health nutritionist. And we are very, it's an honor to have you here, ma'am. Ma'am, if you can please give your keynote address. Dr.
Thank you, Dr.
Yeah. Great. So, ma'am, I have stopped sharing and I've given you the access to share as well.
Yes. Are my slides visible?
Yes, ma'am, they're visible.
Okay. Thank you so much, Dr. Paridhi and Dr. Rakesh, for taking up this important agenda. Because from public health viewpoint, I feel that this is a critical issue and it needs to be addressed. And we are, with nutrition transitions, change in lifestyles, and I will say much of workloads, less time for cooking and all. We are more centralized for these ultra processed foods, sugar and sweetened beverages. But in today's session, we will try to come up with some strategies that will give us a way forward, that in Indian context, how we are going to prevent non-communicable issues. So important thing is, what is the urgency of this important initiative that has been, started by the team. The thing is, like in title itself, it's mentioned, our main focus is on non-communicable diseases. We all know that they are expanding, and I will not say that only dietary consumption is one of the contributory factors. There are other factors as well, but the major contributions for this is that we have, there are even evidences as well that we have an increased consumption of these SSBs and UPFs. And this increased intake is totally correlated with the increased intake of free sugars, fats, and saturated fats. And when we are, increasing the intake of these sugars, fats, and saturated fats, automatically there is a decline in fibers, proteins, important minerals like potassium, zinc, magnesium, and vitamins A, C, D, E, B12, and niacin. And also these are linked with the chronic diseases that include CVDs. Even one survey was conducted that has revealed that 93% of Indian children aged 9 to 14 consumed packaged UPFs and SSPs, and 68% drank sugary beverages weekly. So this, needs an urgent attention, that how our such little kids, they are, attracted for these UPFs and SSBs. Do we have any platform or anything in with us that can control, the sale of these beverages in canteens or something like that? So that needs to be worked out. Although in some schools and colleges they have some school-based policies, but we need to work a lot for this. And if we look the prevalences of these NCDs globally, then 43 million people in 2021 were killed because of NCDs, and around 18 million people they died from NCD before 70 years of age. And surprisingly, 82% of these premature deaths occurred in low and middle income countries. And among these NCDs, CVD was the, I will say, major, giving the major contributions for these deaths. That is 19 million, followed by cancers, chronic respiratory diseases, and diabetes. And on other side, right hand side, if we look into the Indian statistics for NCD disease burden, although the data we have, I have with me is of WHO NCD 2018-2016. At that time, the rate was 63% of all deaths in India. And in that as well, CVD was accounted 27% deaths when compared with the respiratory infections, followed by cancers, diabetes, and other NCDs. Looking into these facts and figures, this really needs a kind attention. So we are talking about, I started with these UPS, sugar sweetened beverages. Basically, what are these UPFs and SSBs? ये क्या होते हैं? So these are, industrial formulations, and they contain low nutrients. Why I am calling low nutrients? Because they have, high sugar, salt, unhealthy fats, and additives in it. And the UPF category is for foods that undergo industrial processing and contains additives, flavors, and colors to increase palatability and shelf life. So main focus when any industry partner, they come up with any UPF, the main focus is how we can improve the flavor, palatability, and how to increase the shelf life so that food can be kept for a longer time. In this, we have examples like kurkure, chips, snacks, sweets, ready to eat meals as well as ready to heat meals. On the other hand, SSBs, sugar sweetened beverages, they, in this we add caloric sweeteners like sucrose, HFCS, that is high fructose corn syrup, and even fruit juice concentrates. Whenever you enjoy, low cost fruit juices, try to see the ingredients. They often, write fresh fruit juices नहीं लिखा होता, उसमें लिखा होता है fruit juice concentrate. From concentrate, they have prepared that 200 to 50 ml bottle. So examples are soft drinks, sports drinks, sweetened iced teas, and even the RTS, ready to drink, ready to serve beverages as well. They are there in this categories. These UPS to have more deeper insights on these ultra processed food. I'm not taking up in detail about the sugar sweetened beverages because they will come under this category only. We usually divide these foods into four main category 1, 2, 3, 4, or we may say group 1, 2, 3, 4. So first, group 1 of these category contains unprocessed or minimally processed foods. This is very important, where we are doing either small alterations or no alterations, or just doing processes like removing inedible parts, drying curly, grinding curly, cooking, pasteurization. And in this we are not at all adding any substances, and but the main our focus is that we want to increase the food stability and make it easier or more diverse in preparation. The example in this category will come, we get these fresh frozen fruits, vegetables, pulses, pasteurized milk, chilled frozen meat, all these comes under, because minimum processing is done. And followed by processed culinary ingredients. Culinary means they are used for some food preparations, cooking preparations. So from group 1, we take the substances, and maybe if they are not the part of group 1, we may take it from directly from the nature. And then processes involved in this is we are doing pressing, centrifuging, refining, extracting or mining, and then these products are used for seasoning, even oils, cooking of group 1 foods like butter, vegetable oils, other fats, sugar, molasses, and salt. After this, we have, divided these. This classification is called NOVA classification. I missed to speak that. This is the NOVA classification. Whenever there is any discussion on UPFs or SSBs, it is very important for all of us to understand NOVA classification. If we don't have any basic understanding about NOVA classification, then we won't be able to understand what are UPFs. Then comes category 3, processed foods. Here we are taking food from group 1 and 2 category, and the methods involved are we are doing non-alcoholic fermentations, cannings, bottling, and again in this our aim is stability and durability of the foods from group 1 and to make them more enjoyable. What we do, canned vegetables in brine, sugar syrups, fresh cheeses, freshly made breads, cured meats, all these comes under processed foods. Because I really would like to make it clear to all of us that technology is a very important part. And we can't say that we can go back to just forget the technology, because हम जैसे advance होते जा रहे हैं हम अपनी roots को. I say that we have to stay connected with the roots, but technology should be used sensibly. And then comes the ultra processed foods. So these are the formulations of the ingredients. Most of the time they are low cost, and they are derived from group 1 foods, and they contain substances that are not at all used in home kitchens. So like I was talking, that technology is important. So it means that category 3s are okay with us. We don't have any health hazards with these 3 categories. But in ultra processed, we are using protein isolates, additives, flavors, emulsifiers, and we are involving lot of processing technologies, extrusion, hydrogenation. Extrusion is okay, but hydrogenation of oils is very major concern for partially hydrogenated vegetable oils. They are there and contributory factor for trans fats. And they are manufactured so that these are convenient, durable, tasteful, and the shelf life is very important in these ultra processed foods. And more profit they are getting, because investment is low, investment is less, and the product is stored for a longer time. So they get then manufacturers, they get relaxed that by meantime the product will be sold out and we will not be facing any kind of losses. In this we have crisps, puffs, kurkure, cookies, biscuits, soups, ready to eat milk, candy, soft drinks. And why we are these UPFs are everybody's favorites. UPFs are favorites. I will say SSBs are also favorites because they are convenient. Ready to eat ho gaye, ready to heat ho gaye, and they are easily available. So we feel like that we don't have to put much of hard work. Just open the noodle can and put some oil, wait for 2 minutes, and then enjoy the food. Such type of technology transfers usually were done for those who were in, high altitude regions, or you can say these technologies were done for our, I will say, army personals who were battling, who were in battlefield. But the purpose came here for, I will say, the technology was meant for these particular segments, but these particular segments are not at all getting that much benefit. But we are focusing much on children and adolescents, and even working mothers. They are also, enjoying these ready to eat and ready to heat meal due to less of time. And the more important thing, palatability. You can check your children if they have started enjoying the chips. Many times you will say, please don't eat. For 2-3 days, they will keep silent. On the 4th day, they will go to the market and will buy that product. Because that is, the foods, they are engineered in such a way that they are pleasing your senses. And they have in this way they are disrupting your satiety signaling. आपको खाना है तो खाना है, जैसे मैंने आपको बताया है. आपका consumption increase हो रहा है, digestion and digestibility is decreasing. You can see school going children and your adolescent as well nearby. They are coming up with the problems of either they are not feeling hungry, or they are feeling like they want to eat more. Means normal food habits, they are not there. So if we go into in-depth, then we will surely realize that these UPFs, consumption of UPFs and SSBs, they are contributing to these, delay in these normal feelings of fullness. And why current food system is failing for that? As I said in my previous slide, that these are the cheap, healthy options available. And I am really, I like this, that marketing is highly pervasive and persuasive. These for branding is done for these UPFs and SSBs a lot, where pervasive means a group of people, they are involved and they are encouraging the population for consuming this. And many people, they get persuaded with like this is very good, like juice pina hai. So we are not looking at that in that fruit concentrate is added. So it means when fruit concentrate is added, automatically that is a UPF. So labeling and our lifestyle is also demanding convenience. If you are tired doing your work a whole day, and then you won't feel like that going to the kitchen and cooking something for you. And same if you have an opportunity to have a tetra pack of juice, and on other side you have to prepare the juice with your hand, then definitely we will demand convenience. So it means that we need to change our lifestyle. We need to change our thought process if we really want to make our system work. And this is really very interesting that UPFs meet the scientific criteria used to label tobacco products as additive substances. These are the findings from the research that was done in 2023, addiction of these highly processed foods, and they have shown that UPFs cause controlled or compulsive use, have mood altering effects on the brain, reinforce behavior, and trigger strong urges or cravings. And that is, if I will evaluate myself for few foods, then definitely I will also fall in that category कि आज खाना खाने को मन नहीं कर रहा, let's enjoy something. So when we starts with let's enjoying something, so that will become a change. So really, in this way, we say that our food systems, they are failing. So what we need to done so that that can be resolved. How can we make these healthy food environments? So for this, first of all, I will say that we need to create a lot of awareness. Although FSSAI, they are working hard. They have their आज से चीनी कम, मीठा कम, तेल कम initiative there. They have very good videos uploaded, and under Eat Right initiative, they are working a lot. But still, our individual responsibility is also there. And if I speak from policy perspective, then we need to provide subsidies on fruits, vegetables, and whole grains, and not to the below poverty line or some special group people. It should be for all, so that we may get attracted towards that कि हमें ये fruit लेना है. Why we don't go for buying purchasing fruits? Vegetables we have, but fruits के लिए हमारा थोड़ा inclination कम होता है because they are very costly. So there should be some subsidies on that, and GST should be lower for nutritious food, and government procurement for healthy meals. It means that we should have some arrangements made by the governments that there should be special, I will say, cell or जैसे Verka booths or booths. They should make booths there where healthy meals they are available on subsidized rates, so people get attracted towards there, that they are getting some incentives. And like health and wellness centers, we should have these healthy meal booths by the government. And not only for us, we should start from the grassroots level. That is, we should provide incentives for local farmers. Like we initiated in the year 2023, International Year of Millets. And at that time, policy was made for, providing more subsidies for millet cultivation. So in that way, we need to strengthen farm to market systems by providing subsidized seeds and making good market channels so that their produce can be purchased by the government itself. And through these supporting agriculture and supply chain system, we must promote traditional and millet-based diets. Because once these diets will be on our table, whether your kids are eating or not, I will say, you should come up with your traditional recipes, and that too in a healthy way. So that आजकल बच्चों को पता ही नहीं है what are the traditional diets. हिमाचल में क्या बनता है, हरियाणा में क्या बनता है, पंजाब में क्या है. Means पंजाब में तो I will say they know, they like chola bhaturas and all, but still they have no basic idea about from where they are eating chola bhatura and samosas, enjoying samosas, how many times that oil has been reheated, is it edible or not. So such type of mechanism is required there. And if we talk about school and workplace interventions, very important. We all are working, so we need workplace food programs. At your wherever you are working, you may initiate a small. You can have a committee, or I will say, like we have kitty parties and all. So you may have that kitty group that will link some of your colleagues who are interested, and will delegate a person that you will provide us one day banana, you will provide us one day apple or orange or something like that. Because once the thing will come to your table, then definitely you're going to eat it. And nutritious midday meals now they have inclusion of these millets, and a lot of amendments have been done in the midday meal school program. And whether this is ICDS in Chandigarh, Punjab, we have worked a lot for that, and they have inclusion of these healthy diets in this. And ban junk food in canteens. This is important. Many schools, those who run canteens, Still they have, these samosas. If samosas, they are making samosas, then there should be a quality check. School का कोई ना कोई committee member होना चाहिए to check the quality of oil in which that samosa has been fried, the quality of oil the vendor is using, and the quality of raw material the vendor is using. And I think they must ban the sale of these burgers and other, sandwiches over there. They are not very good for health. So as Dr. Rakesh was discussing when, giving a brief introduction about the today's workshop, he was talking about incentivization. So we started with that why our system is failing and how we can, make up the healthy food environments. So our healthy food environment is done, where the main focus is the supply chain management, and main other what I feel is the workplace. Workplace में बिल्कुल चीजें lacking है. School में फिर भी there is some I will say gazetted notification by the FSSAI for these midday meals and SNPs. We still have something, but for workplace we don't have. In corporate sectors they have some provisions over there. So what else our government can do? We can incentivize healthy foods, like in previous presentation slide. I said that we need to subsidize fruits and vegetables so that that can be afforded by everyone, and that too universal होना चाहिए. Not कि special group के लिए अलग है और other group के लिए अलग है. And GST taxes on nutritious food that I have talked about, and local farmers को support करना is very important, and fresh fruit so that they should have a proper market channel. In Punjab as well, we are working closely with the farmers, and we are encouraging them for millet cultivation. We have provided them we have connected them with the Department of Agriculture, where they are taking the seed, and we have also connected with the Punjab Agros, where they are packing their flowers if they are providing, or seeds they are providing. So a channel is set, and they have also started giving incentives to the farmers as well, if they are meeting the requirement of the government. So the farmers must also be given incentives for the produce they are healthy produce they are getting from their fields. And government incentives for healthy school meals, this is very important. जहाँ भी canteens है, where we have midday meal program under government setup, there we are providing healthy meals. But what about those schools, those who are running their school canteens? So government should take into loop these private schools as well, and so that they should provide healthy school meals within a normal cost. The cost should not be higher, because I have seen that with the class of the school, the type of fee structure changes. Likewise, the type of just hold on. Likewise, the type of meals they are served, they become costly. So like NDP हमारा जो है meals के लिए भी एक common policy होनी चाहिए. And how we can incentivize these natural and healthy foods? So agar we are providing strategies, financial subsidies for that, this supplementary nutrition assistance program incentives should be there. That is there in India. SNAP is in other countries, foreign countries, and in India we have well-developed system for SNP, Supplementary Nutrition Program. Double Up Bucks was very much liked by me. This, in this is a foreign policy. What they do, if we are providing subsidy to like $10 subsidy for purchasing that good, and after consuming, you automatically that $10 will be added to your account, and again when you will go to buy that same produce or same product, healthy food product from that vendor, you will get, add-on benefits for your next purchase. So this is Double Up Bucks is a very good financial subsidy if that can be implemented in India. And taxation of unhealthy foods, that is important. This is policy approach where we have taxes on SSBs in India, in Mexico, in many other countries. Around 45 countries, they have done endorsements for these UPFs and SSBs. And another is prioritizing healthy foods in stores. That is one of the strategy. And this can be feasible through policy, where we may, store placement regulations. We should make special rules in stores that, like in labeling, we have red, green, yellow zones. Likewise, stores should have special regulations that the customers may just, when they enter in a food corner, they must, in one go, they must aware about, in this side, we have category 1 foods, in the other side, we have category 2 foods, and 3 category, 4 category foods. So such type of healthy foods in store should be prioritized under some regulations, and they should have made special SOPs for the sale of these goods. Another is natural farming initiatives. This can be done through policy. Like we are also running our MIRA project for millet encouragement, and capacity building is also there, the approach. Here, our national millet natural farming initiative. Please excuse me for a while, just. Sorry for this. And another strategy is nutrition education, where we approaches education awareness, where we can involve school programs, conducting workshops for creating more and more awareness. In this, all these initiatives like capacity building, education, community involvement can be done through the convergence with other departments. Market support for producer is also important. The approach is economic and community based, where we can give small payments to local farms so that they must get encouraged for producing more and more healthy foods. And another is de-incentivize. Incentivize को हमने कर लिया. De-incentivize में what we can do, we Government of India having commitment for SSBs, we are putting sin tax on these sugar and sweetened beverages, which was previously discussed by Dr. Rakesh, that 40% taxation is there, GST is there, and these are sin goods. And the tax is called sin tax. If anyone will say what is sin tax, so you should be aware about that. This is the tax that has been recently launched on September 2025 by the Government of India for SSBs. But for UPFs, we really need to work out. We don't have any such, cutoffs for GSTs for UPFs. So that field needs to be explored, and we need to support it by the fiscal modeling. We need to do that. What all can be set up for making the things better for the country. Like told that 45 countries have already implemented, in which Mexico, Chile, South Africa, Colombia stand out for introducing excise taxes and effective FOP warning labels. We have examples, global examples as well. If I will say for UPS, Brazil is there. He first launched in 2014 National Dietary Guidelines, where they have explicitly recommend people to avoid UPFs. And they said this is a golden rule and you all need to follow. And they have incorporated guidelines for children under 2 as well. This is very important. Under 2 को भी हमने जो है ये Brazil ने they have made some mandations, and Brazil also has a national school food program that required significant portion of food to come from local farmers. So see, like in incentivizing the system, one of the thing I was telling that we need to give incentives to the local farmers. So how we can incentivize them? We can make the policy, वो government बना सकती है, and we can get the goods. And Chile has also implemented FOPL warning labels for these foods that are high in sugar, fat, sodium, energy, and these labeled products are also banned from being marketed or sold in schools. So this is good. Mexico has instituted an ad valorem, like we have GST, they have ad valorem % of value tax on packaged food. कितना % उसमें sugar डला है, उस sugar % के हिसाब से they are adding tax. The amount of that salt, sugar, fat, that item is added. So on the basis of that, tax will be there. And Malaysia and Israel have also adopted the guidelines that has been mandated by Brazil as well. They have adopted this Brazil model, and their recommendations also include that we must reduce or avoid UPFs. And for SSBs, we have examples of Mexico. Mexico was the first to implement a volume-based tax on SSBs. United Kingdom introduced a tiered soft drink industry levy based on sugar concentration. And this design successfully incentivized manufacturers to reformulate their drinks to have lower sugar content to avoid the tax. And South Africa is another example. It has implemented sugar-based tax similar to the UK policy. France has replaced flat tax with a sliding scale tax based on the amount of added sugar per 100 ml. I think this one is good. The tax should be based upon the amount of. अगर आपका जो है normal आपका जो recommended levels है उससे ऊपर जा रहा है तो the tax should be based on that. That will also satisfy the manufacturers as well. Otherwise, due to lobbying, it really becomes difficult to come up with some policy regulations for these UPFs and SSBs. We have Latin American countries where Chile is leading, where we have good FOPL warning signals, symbols for making public aware about that particular foods are high in sugar, fat, or salt. And in India, we are still in dilemma with which category we need to go. Although we do have star rating, but being a public health expert, we are not at all satisfied with the star rating of the food products, because if you are adding, a small portion of nuts or some other good, that will increase the rating of the product. So we say that that product is good. So it is based upon the number of nutrients that are there, the number of ingredients they are there in that particular food. And many countries have banned SSBs from school meals and vending machines. Brazil and Chile have efforts in banning all UPF SSB marketing in schools. So if we recap that all these countries are focusing much on the school-based interventions, because if our eating standards and our developmental standards, they are maintained at the school level, then definitely we will be, having a healthy nation, healthy adults, healthy nation. So that can be achieved. So this was discussed at September 22, 2025. The 40% rate on SSB classify them as sin goods in line with this. And implementation challenges are there. Like I told you that industry lobbying is there, because industry partners, they are very reluctant for a lot of things. Like in India, if I discuss, they never feel कि हमें जो है वो warning symbols देने चाहिए, because in India, if we are thinking that this is red, so people, they will not buy it. Like for veg and non-veg, we have these front of pack labeling. So they say that अगर red sign आ जाएगा, they will not buy. So better to go with the star rating. And the public health professionals still feel that star rating is not appropriate FOPL mechanism for making public aware about that. And consumers' habits and affordability. So we need to create more awareness and education so that our habits can be, appropriate. So better things start at home. आप जब घर पे हो तो try to enjoy, a quarter plate of salad or a fruit, something like that, so that kids become aware about they have to eat, fruits and vegetables. They are good for health. If you are bringing spring rolls and you are, making parties, regular parties by enjoying pizzas and all, so that will, create a hindrances in this. And monitoring and enforcement mechanism is very, very important. Monitoring and enforcement is lacking because we are getting all the goods. अब तो Blinkit है आपका fresh है मतलब lot of channels are there from where we can get all the things on our table. So implementation challenges, that's why I say that lot of challenges they are there, and government and policy makers, they need to work hard. And for that, the role of academicians and many stakeholders, like in today's session, I will say we have ECO, we have Sipher with us. They are putting a lot of hard work. By these small efforts, we can make a change. Sometimes we feel like हमारे करने से क्या होगा? No, if a small group will start working at their own, definitely that group will meet, and then our implementation challenges, problems, these can be resolved. So way forward from my side is that NCDs can be easily preventable through diets, and there are bigger chances if we will come up with the fiscal policies incentivizing and de-incentivizing. That is definitely going to influence our choices, and for that policy needs to work hard, and awareness can be done by the different stakeholders. It should not be made a baby of FSSAI or public health department, I will say, or health department. So, and regulations also needs to be made more and more strong and strengthened. That regulations ban jati hain, but kitna percent we are following, that remains a question mark. And for that, we also need to encourage healthier food ecosystems, where I gave the example of how can we go about it by encouraging farmers, having good supply chain management, building good food environments at school, workplace, etc. And healthy food systems can be done if we would be able to, provide good incentives to local farmers, because local farmers are very important. Once they are boosted automatically, that will make a chain to encourage other farmers to have follow those practices. And food innovations are important, but they should not play with the health of the people. They must have clear cut warnings on the packets, or and especially the marketing strategy needs to be worked out. हमारे ये juices के लिए, drinks के लिए, we have lot of ads, and a lot of face values, but for our healthy food, healthy meals, or I will say encouragement of some healthy food choices, we are not doing any kind of marketing for that. That is the baby of these public health professionals, or either FSSAI or either health department. And media is rarely, encouraging the things. Only when we have some special days, World Food Day or something like World Health Day. So on these days, we are just passing the messages to the communities and to public. But it should be in routine, and the advertisement of all UPFs should be banned. That is very important. Monitoring and evaluation should be there, because with this we would be able to evaluate the outcomes. Like we have, started with this syntax regulation. So this has been, mandated in 22nd September 2025. So what we may do, we should, start collecting the evidences that what was the status of the, I will say, the sale of these UPFs, SSBs, sorry, SSBs के लिए है ना, तो SSBs का सेल कितना था सितंबर 2025 से पहले, और 1 साल 2 साल के लिए हमें रिव्यू करना चाहिए कि इनका सेल अभी भी बढ़ा है या कम हुआ है, and what is the status of our non-communicable diseases. So with that, we correlate the overall outcome of the policies that we make for our healthy nations. So with this, I say thank you so much. I hope I was quick and precise for presenting this important issue. Thank you so much. Over to the organizers. I hope बहुत ज़्यादा मुझे I don't know about the time.
Hey, Dr. Poonam, thanks for your keynote address. And you actually highlighted the incentivizing, how to incentivize the healthy food and disincentivize the UPFs and SSBs. And you also told about the urgency of the issue. You told about the Indian burden. It is the Indian burden of NCDs is as high as 63%. So we have to be very quick on the issue. And you also told about what are UPFs and SSB low. These are the low nutrients and industrial products.
Products.
And they are to increase the shelf life and to increase the taste of the food. And UPS, you told about the NOVA qualification. You told about the definition of UPS and why are the UPS favorite? Because they are palatable. And why current food system fails, and why wash for creating healthy food environments. Why we should create for healthy food environments. So I'll request you to just send me. This is a very comprehensive presentation. So kindly send me a PDF of the presentation and also send me some key recommendations. Only the doable ones. We don't want the very detailed thing. Only the doable, which the governments can do it, right? So thanks a lot. So Dr. Paridhi, I'll request you to just take a snapshot of all with videos
Yeah.
on
Yes, yes.
before we start with Dr. Tina's presentation.
So requesting everyone to please switch on their videos.
I call it golden moments,
We have beautiful faces and even more beautiful smiles. So everyone, please switch on your camera so that we can take a picture to, commemorate this webinar.
So we have Dr.
All right.
Ram Khan, Dr. Rakesh Gupta with us.
Okay, so on the count of 3, big smiles. 1, 2, 3. Right. Sorry, I'll just take one more.
Yeah.
1, 2, 3. Right. Thank you.
Thank you.
So, thank you, ma'am, for your very comprehensive presentation on the topic. Moving forward, I would like to invite Dr. Tina Rawal, who is a senior research scientist at PGIMER. She's a trained nutritionist and has a special interest in lifestyle-related non-communicable disease and its associated risk factors research. She'll be giving a talk on the Strengthening Food Environment, Learnings from Let's Fix Our Food initiative. Ma'am, over to you.
Thank you so much. If you may allow me to share my screen. Thank you.
Yes, ma'am.
I hope my screen is visible and it's in the slide mode, right?
Yes, ma'am, it is in the slide mode. Thank you.
Thank you so much. So thank you to the organizers, Dr. Rakesh Gupta, I think, for giving this opportunity and sharing some of the learnings from the ongoing initiative that's called Let's Fix Our Food in what we have been implementing, I think, past 2 years. So maybe just coming up, and Dr. Poonam Khanna has created and provided an overview. So I think that makes it easy for us to understand why there is a need to address this an important issue around ultra-processed food and SSBs. So coming on to the issues, so Let's Fix Our Food focuses around the youth empowerment and importance of health literacy among these people. As we all know that in terms of the issue, so by 2030, there has been a projection that over 27 million obese children and accounting, which may be equivalent to the 1 in 10 children worldwide. And according to the CNS, in our comprehensive national nutrition survey, there are only 11% of the adolescents who are having adequate dietary diversity. Therefore, the availability in terms of the accessibility and the consumption of unhealthy processed food in school canteen has increased, which has been highlighted in the earlier session also, and only 38% of young adolescents. So it's not only about the unhealthy dietary patterns, but of course, at the same time, the sedentary lifestyle. So the reports has suggested, and the earlier evidences has shown that there are students and children who are doing less of the physical activity and more involved in the sedentary lifestyles. In terms of the earliest evidences, what has been led to the Let's Fix Our Food initiative is in the school-based environment study, which has been done, I think, in the schools and colleges in Delhi and NCR to understand the availability of foods around schools and the educational institutions. So availability of the food and beverages which are there around the educational institutions were high in fat, salt, and sugar. The healthy foods and the beverages which were expensive as compared to the foods which are very high in fat, salt, and sugar. And the vendors observed outside the schools at the dispersal and at the lunchtime around the college throughout the day. And the schools which have been included as a part of this study included in terms of the private schools and the colleges which are exposed to the HFSS food advertising also. In another evidence where we have collated some of the evidences in the terms of the content analysis of the advertisements, which are focusing around in the popular TV channels among children and youth. And this data has been collected before just initiating of this COVID era, where we have done some of the studies and we have included this content evaluation of the advertisements. The total duration of the programs which are observed during this period of time during which where the study has been implemented, out of 168 hours and over the 6 weekends for children and youth channels, which were most famous among this age group, 6 weekends for children and the youth channels. A total of there were more than 5,000 advertisements which were seen on selected national level children and youth channel over a period of 3 weeks. And this, out of this more than 5,000 and advertisements, approximately 1,700 were food advertisements, and 88%, more than 88% of these food advertisements were related to HFSS advertisements. And exposure to such an advertisement is higher in children than the youth. Looking at this, I think the outcomes of this study, I think we have come up and there is a high-level meeting which was convened under the aegis of Niti Aayog in 2021. And to address the obesity among adolescents and especially in the children, the 5 policy areas which has come up as a part of the high-level meeting, which includes the double duty actions, front of pack labeling, nutrition literacy approach to be led by adolescents, taxation of foods which are high fat and salt and sugar, and regulating private and public media advertising of HFSS foods, which may include improvement in the school food environment, empowering adolescents in decision-making and literacy, regulating the availability of the unhealthy food items, meaningful involvement of adolescents in addressing the unhealthy diets, which may become the reasons and the measures to combat the obesity and overweight in obesity, and enhancing the family and community engagement, because this is a whole of community approach where it is needed. So Let's Fix Our Food aims to transform the attitudes and the behavior of adolescents across context, and youth networks, organizations, so that no adolescence is left behind. So this is an ecosystem where all the partner organizations have come together and played important roles, where they are the enabling partners, which included the WHO, World Food Program, UNICEF, knowledge partners, implementing partners, including NIN, PHFI, and IEG, and adolescents themselves as partners, leaders, and beneficiaries of this initiative. In terms of the activation, so it is very, very important that how we are empowering adolescents and how we are making them their involvement very, very meaningful. So there were the components included social media optimizations, where the campaign has been going on with the adolescents, with the school students, with the college students. A network of adolescents pan-India has been created, who are contributing to this campaign in creating an awareness and strengthening the food environment, especially around the educational institutions. Number of podcasts have been planned and now been available in the public domain, where the youth has initiated, I think, the discussions with the public health experts on importance of creating this food environment really healthy and making it little more meaningful involvement of their inclusion as a part of this initiative. There were various experts, I think, led op-eds and opinion articles have been published since 2 years, which included, I think, 12 opinion articles around the fostering and importance of fostering a food environment. So these are some of the glimpses which has been come up as a part of the initiatives. Adolescents were part of the various important platforms where they have been involved to raise their voice, amplify their requests and their demands where it is needed, and importance of creating this food environment, especially around the education area, to the families and to the community at large. So LFOF and then Let's Fix Our Food works around the three basic pillars, which include the policy level actions, where the strengthening of healthy food environment policies, regulating HFS marketing, promoting front of pack labeling, and improving the school norms included, aligning it with the National Multi-Sector Action Plan and the Health in All Policies approach to strengthen the nutrition governance, and building an evidence through youth and community surveys on dietary behavior and environmental nudges. The second pillar talks about and works around the youth-led health promotions, where they are themselves are involved in co-creating IEC and the campaign material with adolescents to promote healthy diets, empowering youth leaders and ambassadors for the nutrition literacy and peer engagement, conducting workshops at the school level, at the college level, for creating peer-to-peer education and empowering their peers through digital campaigns, which included and creating an awareness and youth-led actions. It also involves the capacity building and development of the resources, including the toolkits, infographics, and sensitization modules for the schools and communities, and encouraging collaborations between youth, educators, policymakers to sustain behavior changes. As a part of the Let's Fix Our Food initiatives, a survey was administered and a nationwide data was collated from all these states, I think, capturing the factors which are influencing the food environment, and approximately 1.43 lakhs adolescents have participated in this survey, which was launched through UReport, platform for the UNICEF. And based on the results, which have highlighted that more than 67% of adolescents indicated that the food advertisements influence their food choices. And more than 43% of adolescents responded that the availability of information about unhealthy food items may prevent them from consuming such food items. At the same time, about half of the adolescents responded that they get maximum information nutrition through schools. So schools are very, very important platforms where the empowering and the nutrition literacy can be enhanced. Nearly 30% of adolescents indicated that they can't eat healthy foods due to the higher prices. So there, I think it is very, very important, the issue of incentivizing and incentivizing the HFS and the healthy food items. Around 78, based on the survey results, 72% of the adolescents responded that they read nutrition labels. So it is very, very important to have this front of pack labeling that is more comprehensible and easy to understand for all the participants. As a part of the evidence generation under LFOF, there was a review has been done on regulating the food advertisements to protect children and adolescents from the exposure of foods which are high in fat and salt and sugar, and the regulatory Indian environment for advertising this HFSS food and non-alcoholic beverages on various media was reviewed, which included the global practices also. And the global evidences revealed that the children exposed to food advertisement on TV, games, or advertisement through games consumed an average 60 kilocalories and 53 kilocalories, respectively, more than the children who are exposed to non-food advertisements. And children who watched cartoon food advertising ate 45% more than children who just saw, I think, non-food advertising in the developed countries. So there is a need for a robust regulatory framework to protect children and from the HFSS food marketing, not just what is directed at them, with a clear evidence-based food classification criteria. So those were some of the outcomes of the evidence which was generated as a part of the LFOF. There were 13 policies related to the food advertisements exist in India, which has come up as a part of the outcome of this paper. And the misleading advertisement guidelines, which was released in 22, was promising, and there is an opportunity to strengthen the food environment regulations in India across all the media and settings. But at the same time, there is no clear definitions for the junk food. There's an ambiguity regarding terms used in programs or the channels meant exclusively for the children. There's a lack of description of what amount of to an advertisement that addresses or targets or the uses for the children. And there's a lack of specific objectives criteria for defining the brand extension in indirect advertisement. At the same time, there was a scoping review was conducted, and which was around the overweight and obesity, and to come up with the recommendations for the social and behavior change communication strategies. So 6 major review instruments included RKSK program, School Health and Wellness Program, Eat Right, Fit India, NPNCD, and FSSAI regulations, which has come up, and the result has clearly shown that there is a need for strengthening the SPCC strategies related to the prevention and management of obesity, especially around the screening and counseling to cover all the age groups, particularly focusing on adolescents and youth. The NCD stands out as a noteworthy initiative. There is a considerable potential for this program to enhance SPCC strategies to have an overall effectiveness. There is one more review has been conducted where we have looked at the potential impact of the health taxes. This was last year's before the GST norms were come up. Demand for the unhealthy food and beverages, where the WHO, as we all have, I think, what we have heard in the earlier session, the WHO recommends that the taxation is one of the most cost-effective tools, and over 70 countries are using the health taxes as an effective tool for reducing the consumptions of SSBs and unhealthy food items, which we have seen, I think, in some of the earlier slides. And there is an increase in the SSB prices by 20%, which may lead to the reduction in the consumption of SSBs by around 20%. Taxation will increase the revenues for the government and can be used to subsidize for the healthy food options. At the same time, the major come up as an outcome of this paper was taxing unhealthy food items is likely to reduce the demand while increasing government revenues for reinvestment back into the public health programs and the policies, which may reduce the obesity and incidence of the non-communicable diseases in India. These were the major evidences which has come up as during the tenure of the LFOF, what the evidence was generated in the last few couple of months. The impact of LFOF has led to the discussions in the development of the strategies for improving nutrition in India, and the LFOF consortium, where included the partners from NI, UNICEF, IEG, WHO, World Food Program, have contributed in drafting the strategy document, adopting the large force approach under the aegis of Niti Aayog, and the consortium has been submitting the outline and the content, and it is under review at this point in time. The impact of LFOF, where the adolescents themselves are involved as equivalent partners, have shown that school-based initiatives under FSA, The FSSA has joined as a consortium partner in the LFOF. The LFOF reached through the surveys more than 1 lakh of adolescents pan-India, reached over 2 lakh of people through social media, and reached approximately to 10,000 schools through our NEET survey, which is like an assessment tool for assessing the food environment around the education institutions in the government and the private schools in India. So the results are in the process, which we have, I think, released in the near future. The journey, what we have reached in as a part of the LFOF schools is like a meaningful youth engagement, and there is a need for creating this food environment through NEET tool assessments and developing a network of LFOF network of these schools in India. The key recommendations which are there as a part of the LFOF is for the incentivizing the manufacturers to reduce the quantity of sugar, salt, and fat in their products, increasing the awareness of and access to the access to and subsidize for the non-sweetened beverages like fruit juices, clean water, fruits and vegetables. More importantly, introduce in the effective food policy in terms of the labeling, incentivizing the farmers to increase the production of fruits and vegetables, additional health taxes in terms of HFSS and SSB food items, and restricting marketing of unhealthy food and beverages. So the newly initiative, I think, where we have seen the sugar boards and the importance of the oil boards. It is very, very important how the youth at the school level, at the home level, at the community level can create awareness, and the youth-led actions may increase their meaningful involvement of adolescents and youth for creating this by displaying this sugar boards, the oil boards highlighting the sugar and oil content in common food and drinks, the healthy canteen policies through youth participation in developing and monitoring the school canteen menus, promoting nutritious, locally sourced food, peer-led actions where the health clubs and debates, campaigns promoting the healthy food choices can be involved, and the local actions where the youth-led mapping and the assessment of the nearby food outlets, advocating for access to the fruits and vegetables, safe street foods, and the collaborative campaigns where the partners with the local vendors, municipalities to promote healthy food zones, youth-led IEC and the events, and at the same time, at the home level, it is very, very important that how the families can be encouraged to read food labels, reduce sugary drinks, and cooked balanced diets. Kitchen conversations where the adolescents can be initiate discussions to the healthy oils, millets, portion sizes at home, and the social media activation, which is an important component in today's generations. So thank you, and over to you.
Thank you, ma'am, for giving a very comprehensive overview about the initiative, and it was really an honor to have you speak on it and talk about how youth should be involved, because most of the advertisements are aimed towards them. So thank you for sharing your thoughts on this. Dr. Rakesh, so I would invite you to please welcome Dr. Bhalla, our chief guest for today's webinar.
Can you please share the slides?
Yes, just doing that.
So we have our chief guest, Dr. Sandeep Bhalla, who is Vice President of the Projects, Health and Education with the HECO India. He is a highly accomplished and comprehensive professional in the field of public health, with focus on implementing and managing public health programs. So over to Dr. Bhalla with his chief guest address here.
Thank you, sir. And first of all, extremely sorry that my flight got delayed. I just landed at Bangalore, and sorry for the inconvenience. First, I would like to say my sincere gratitude to Dr. Rakesh Gupta, President of Sipher, Dr. Poonam Khanna, the additional professor, nutrition, DCM, and PGIMER Chandigarh, Dr. Tina Rawal, my ex-colleague from as a senior research scientist from Public Health Foundation of India, Dr. Shankar Prenja, Professor of Health Economics and at DCM and PGIMER Chandigarh, and all other takers of this particular initiative, which is a very, very dire need of an hour. And this is an online consultation on incentivizing the healthy food and de-incentivizing the ultra-processed food and sugar sweetened beverages to prevent non-communicable diseases. As you all know that the epidemiological transformation which has happened in the last 1.5 decade from the communicable to the non-communicable diseases, and the burden of NCDs, which is a recent global GBD report has also come, which has been published into the Lancet 2025, but they have captured the findings till 2023, and it has clearly mentioned that two-thirds of the burden of the diseases are basically because of the NCDs. And India faces a growing epidemic of NCDs, and even the Dr. Mohan's in-depth study about the diabetes has given us a very, very, you can say, the opening eyes to all of us to understand that how not only the diabetes, but the obesity, now it is known as diabesity, it is increasing in a very big way in nooks and corners of the country, not only limited to the rural, but also not only limited to the urban, but also to the rural areas also. Clinical care alone cannot curb this rise, and prevention through healthier food environment is essential. And fiscal policies, which includes taxes, subsidies, have proven globally effective in shifting the consumption of patterns and funding public health programs. If you see that this high sugar, salt, and fat content drives metabolic disease and undermines the nutrition security, and India NCD crisis is not only clinical but economic, with high out-of-pocket spending and productivity loss also. Countries like Mexico, UK, and the Chile shows clear reductions in SSB purchases after taxations. And marking tax revenue for school nutrition, safe water, and fruit vegetable subsidies strengthens political and public acceptance. So a sugar density based exercise on SSBs and select UPF could drive double benefits, aligns with WHO and World Bank recommendations, India NCD prevention roadmap. So the role of the healthcare professional, doctors and the nurses and other healthcare colleagues are trusted. They are the trusted voices, and their advocacy can shape public opinion and influence public actions. Health professionals can also contribute data, case examples, and local narratives that humanize the impact of this unhealthy diets. So I think this is a very, very important topic and a need of an hour. ECO, which is Extension for Community Healthcare Outcome, which is working in the field of capacity building since 2008 by creation of a trust in India. We only believe in dissemination of knowledge to the last mile as a hub and spoke model. And today, the colleagues, those who have joined, you must have joined from the different parts of the countries also, but you can see that how best you can interact with your key opinion leaders and you can put it up your queries and the doubts so that you can get the evidence-based solution. That is what the ECO is. It's a case-based learning model. And I would sincerely pay my gratitude to Dr. Rakesh Gupta, the leading multiple initiatives with the ECO and disseminating the knowledge to various topics. And it has really impacted a lot of you can not only the healthcare professionals, but also ultimately the communities in a different way. So on behalf of ECO, I can only say a big thank you to each one of you for joining this. And whatever best we can do, we are always there. Our support is always there. Stay safe and stay healthy and have safe food and enriched food, which can enlighten you and which can enhance your lifestyle. And that is what I can only say at this moment. All the best. Have a fruitful learning experience. Thank you, sir.
So thank you, Dr. Bhalla, for joining, for being able to join actually, since your flight was late.
Yeah.
So, and for concluding remarks regarding all the presentations. Yeah. So thanks a lot. Yeah.
Sir, if you can just be online, we can take a quick photo, all of us, a group photograph. So requesting everyone to please switch on their cameras quickly. All right. So on the count of 3, big bright smiles. 1, 2, 3.
Yeah.
Right. Thank you. Thank you, sir.
Thank you.
So, so do we go for the question answer section? Or
I think they can just send their queries on our email ID. Email ID has already been shared.
Yeah.
But we can have some concluding remarks from the experts. Dr. Rakesh Gupta is with us, so he may just give us some concluding remarks, and others too. Just a minute each.
So I'll open the floor for discussions.
Dr. Rakesh Gupta first. Yeah.
Yes, yes.
Yes.
Thank you,
Yes,
Dr.
Dr.
Rakesh ji. I think you have covered a very important topic, and the presentations have been very elaborate, comprehensive, and useful.
Yeah.
I think where we need the maximum impetus is a strong political will, and we need to have the robust implementation of the policies and programs which have been suggested, along with regular review and evaluation. These are the basic tenets, for success. So I think NCDs, which is a big problem for the country, and we have known it for now over 3 decades. And India, of course, has taken useful strides in the progress to control NCDs. But as we have seen, a lot requires to be done. So I consider that's the takeaway messages for all of us who are participating in it. Only thing we require is sustainability of our education actions and continuing with the large public support. Thank you very much for giving me this opportunity.
Thank you, Dr. Rakesh. So Dr. Ram Prasad is with us from Manipal.
So a very good afternoon to all of you. Thank you so much. Really pleased to be a part of this webinar on ultra processed foods. The only point that I wanted to make here is the availability of natural fruits, high quality fruits, and even vegetables which we can consume at a quick time. In the sense, people are hungry, people are looking at quick food, but it also has to be nutritious. So the ultra processed food and highly processed food, what they've done is they have actually made it available. That is, accessibility has been created and affordability has also been created, because it's available right from 2 rupees, 5 rupees, and so on. So if we are able to actually make an effort in providing high quality fruits and vegetables, particularly in campuses and where youngsters are working, I think we'll be really implementing what we are talking about and what we are discussing about. It takes a lot of effort, a lot of dots have to be joined, but if that's made available, I think a lot of people will shift from consumption of ultra processed foods to naturally food, high fiber foods, and that's what will contribute to better health and better wellness. Thank you so much. Thanks a lot. Thanks so much.
Paridhi, you may just call other participants if they have any suggestion or any concluding remarks. So anyone may speak. Yeah.
Yeah. So given the rights to unmute yourself, so anyone wants to say or put any of the comments on the whole webinar, we have Ankit Patel, Mamta Pradhan, Vibha Singh.
We have Arushi Sabarbal. So Arushi, do you have any comments to make?
Good afternoon, sir. How are you?
Yeah, I'm fine. Yeah.
So I just found the session very, very informative. And my only input would be that at the state level, what I feel is at the state level, whatever we could do, we would try our level best.
Yeah.
Because that is what we would like to, as you discussed this with me earlier also, sir.
Yeah.
We were looking forward to having a conversation with the FTA. So we would like to give as much support to this cause as possible at the state level.
Yeah. And I think tobacco-free education institutes is a very good concept, which can
Yes,
be
sir.
replicated for HPFs, right, and SSBs too. Yeah.
Absolutely. And so we have the tobacco free youth campaign also going on right now.
That can also
So
be.
we have, we have more than a month. So we could take this up as a part of that campaign also. Yes, yes, yes.
So
Thank you so
anyone
much,
else,
sir.
please? Thank you. Thank you. Anyone else, please? We just have 2 minutes.
Dr. Vibha, would you like to say anything? You are working with working in the pediatrician department, so maybe you would like to give your comments on this? Or anyone else would like to say? You can unmute yourself.
So I think Dr. Paridhi, so you can just proceed with the formal vote of thanks.
Right. So thank you, everyone, for joining today's webinar. I would like to thank Dr. Rakesh for giving us an opportunity to host this webinar, Dr. Poonam Khanna for giving her keynote address and a very important one as well. I would also like to thank Dr. Tina Rawal on giving the talk on the strengthening food environments and just giving us a brief overview on the Let's Fix Our Food initiative. Thank you very much, ma'am, for sharing the survey results. I would also like to thank Dr. Sandeep Bhalla, who was a chief guest, for joining this webinar on such short notice. I would also thank our wonderful participants who have taken out the time to join this webinar and share their comments on this very important topic. So thank you, everyone, for joining this webinar, and thank you. And I'll be sharing a feedback link after this session. It'll be posted on the announcement board. So I would request everyone to please fill that link. And if you have any questions, Dr. Rakesh has posted the email address on which you can send your queries, and we would ensure that we get back to you with the answers. So on that very note, thank you very much for
And
joining.
another thing, Dr. Paridhi, we'll be sharing the link of the recording also with all.
Yes.
So it will be available on Sipher Health News YouTube channel for all to just review, have a look at it. Yeah. Thank you.
Once we upload the video, we will share the link with all of you. Thank you very much.
Thank you. Thank
Thank
you all.
you.
Thank you. Thank you, please.